Good evening. My name is Pedro Rivera, and this is Bio 520, instructed by Dr. Sandra Barrera. During this presentation, I will be discussing respiratory acidosis and compensation. I will begin by defining respiratory acidosis and how oxygen, along with carbon dioxide, play an important role in its effects. Following the definition of respiratory acidosis, I will begin to describe symptoms that can be expected with this condition. Furthermore, I will cover some treatments that can be expected to counter respiratory acidosis in order to restore acid-base balance. Finally, I will cover some diagnostic measures that are helpful in identifying this condition. Now, without further ado, let us begin. All right, respiratory acidosis is a condition in which our body cannot eliminate the excess carbon dioxide from the lungs. As stated by Patel and Sharma, this condition is normally due to a failure in ventilation that leads to an accumulation of CO2. As we get further along in this presentation, I will discuss that there's underlying conditions that cause respiratory acidosis. So providers and medical staff have to try to address those underlying conditions in order to reverse the effects of respiratory acidosis. So moving forward, oxygen levels in respiratory acidosis are reduced, and the exchange between O2 and CO2 is obviously disrupted. Normal pH levels can be said to be around 7.35 to 7.45. This is a very, very small margin that must be maintained in order to sustain homeostasis. There is little room for deviation. So why is this important, and how does it cause an acidic state in blood? So let us look at the picture presented in the slide with the kid with the brown bag to help explain this process. So typically, we can correlate somebody breathing into a brown bag with when somebody is hyperventilating, as when having a panic attack. So what is happening during hyperventilation is the attempt in the individual to take in more oxygen. So they're trying to breathe, they can't breathe. The problem lies in the fact that during this process, excess amount of CO2 is actually being released, is being expelled from the body, creating alkaline conditions within the body. Thus, when an individual is experiencing this type of medical manifestation, breathing into a paper bag, as seen in the picture, allows for CO2 to re-enter the body instead of being expelled outside into the air. So basically, that CO2, it remains in the bag, and as the person breathes, then they take it back in. It's not being lost. So CO2 is very important in the regulation of acid-base balance. When CO2 enters our body and combines with when it combines with H2O, water, it forms carbonic acid, which aids in countering the alkalosis. So now, using this example, we can explain the opposite effects as when explaining increased levels of CO2 in the body. So if decreased levels lead to alkalosis, increased levels should lead to acidosis. The more CO2 that remains in our body, the more acidic our blood pH will become. During respiratory acidosis, the fact that a patient cannot adequately expel CO2 leads to blood pH levels that are less than 7.35. And as I explained before, normalized blood pH levels are between 7.35 and 7.45. So anything below 7.35 is considered acidic. Anything above 7.45 is considered alkaline. Now, let us discuss how this condition can be reversed and the metabolic processes that take place. In order for respiratory acidosis to be countered, the balance between CO2 and bicarbonate, which is also known as HCO3, has to be corrected. The way the body performs this function is via our kidneys. So our kidneys will begin excreting more acid found in the form of hydrogen and ammonium within our body. But at the same time, the kidney begins to reabsorb bicarbonate, which is a base. As you can see in the picture displayed in the slide, we're trying to get rid of hydrogen while taking in more of the bicarbonate. This in turn helps pH levels to stabilize and thus reinstating homeostasis. So as if we have an acidic state and you want a base to counteract that, that's where bicarbonate comes into place, and it helps normalize the pH level, come back to normal levels between 7.35 and 7.45. Now, there are various symptoms associated with respiratory acidosis. As already indicated, this condition is attributed to high levels of CO2 that cannot be released from the lungs. In addition, a release of catecholamines is experienced. So catecholamines are hormones that are produced by our adrenal glands during periods of stress. So these hormones also contribute to the various effects experienced with this condition, which include fatigue, confusion, anxiety, headaches, shortness of breath, sweating, and in severe cases, it can lead to coma. So it's a very, very, very serious medical condition that has to be addressed as soon as possible. So there are multiple treatments that can be used targeted at the underlying condition that caused respiratory acidosis. Remember at the beginning how I indicated that it is the underlying condition that has to be addressed in order to correct respiratory acidosis. The Cleveland Clinic indicate that treatments may include, but are not limited to, bronchodilator drugs in order to reverse obstructions, non-invasive positive pressure ventilation, and oxygen supplementation. Patel and Sharma suggest that respiratory acidosis must be treated with extreme caution. So hypercapnia, which is another name for respiratory acidosis, has to be treated, according to Patel and Sharma, gradually as to not affect cerebral spinal fluid. They indicated that rapid alkalization can actually cause a patient to begin having seizures. So you're really not helping them out if you do something like that where you're um, instead of making the condition better, you're going to make it worse by trying to um, bring the pH level up in a rapid manner. So extreme caution must be um, practiced. All right. Such as there are various treatments, there are also various diagnostic measures available. One of the most important laboratory tests available to determine respiratory acidosis is an arterial blood gas. This is where a sample of arterial blood is taken and then analyzed to determine pH, bicarbonate, and PaCO2. As discussed earlier, normal blood pH levels fall between 7.35 and 7.45. So this test will help to determine where the patient falls. An X-ray and also CT scan may also be useful to help with diagnosis. Other lab tests that are used for are electrolyte and lactic acid level. Lactic acid can be expected to be elevated with respiratory acidosis. In conclusion, we have covered respiratory acidosis and how oxygen, along with carbon dioxide, play an important role in its effects. I also described symptoms that can be expected with this condition. Furthermore, I covered some treatments that can be expected to counter respiratory acidosis in order to restore acid-base balance. Additionally, I covered some diagnostic measures that are helpful in identifying this condition. Lastly, as a refresher, the diagram displayed in this slide can help in visualizing how PCO2 and HCO3 and bicarbonate, also known as HCO3, counteract each other to affect pH. The first image displays a normalized state as seen by equal parts of PCO2 and HCO3. As PCO2 increases, the pH level drops. The body then compensates using its metabolic processes to increase HCO3 levels, normalizing pH levels once again. I hope this was helpful. Thank you for taking the time to listen to my presentation. I hope you enjoyed. This was Pedro Rivera, Bio 520, instructed by Dr. Chandra Barrera. Thank you.